Dr. Wallskog, I just have to go to you because you have direct experience. I almost feel like bringing up Brianne Dressen to talk about the concealment that you witnessed firsthand when it came to your working with, Bree's working with NIH officials, trying to do studies, being carried along with some assurance that this was going to be revealed to the public, and it never was. Just talk about that level of concealment. Again, there's going to be so much evidence of this if it hasn't been destroyed. This is just the tip of the iceberg, what we're seeing here with myocarditis. But talk to what you and your fellow vaccine injured who were dismissed, who were gaslit, who were treated horribly. I mean, horribly when you came to the United States Senate and asked to be heard by senators and their staff, you were treated. Describe how you've been treated.
Well, thank you, Senator Johnson. So what I'd like to say is being vaccine injured in this country is unfortunately a huge polarizing event, which it should never be. If I could describe one word that I think all, if not most, vaccine injured will say is, what's one word that describes your experience after your injury? And it's abandonment, okay? We get attacked, we walk a tightrope. We get attacked from the right say, we're stupid, we shouldn't have got a shot, we should die. Okay, and I could show you social media stuff. The left says we're anti-vaxxers, which to me is one of the most ignorant things to say of myself because all my children have been vaccinated. I got vaccine injured because I got vaccinated. But still, regardless, we get called anti-vaxxers. We report these to VAERS, okay? Nothing happens. I had an adverse event, which was, delayed the AstraZeneca trial in the United Kingdom, 2 times for 3 cases of transverse myelitis. I expected a call the day after. Days passed, weeks passed. By 3 weeks, I called the CDC myself and demanded, a response. I always thought, I'd get this quick response and someone would help us. All of us that are vaccine injured know there's no phone call coming. There's no help coming. We have repeatedly met, and Brianne Dressen, who's my co-chair with Reactine, have met with Peter Marks over and over and over for the last, for a period of about 2 years. We have been placated. We have been blown off. We bring up adverse events, the neurological adverse events. We bring up the MIS, which is the multi-system inflammatory syndrome. We bring up the myocarditis. He thanks us. He says he'll get back to us. He never does. That went on for 2 years. So for people that think it's this kumbaya where people are listening to us and people are all in these federal agencies are trying to help and get to the bottom of it, it is the farthest from the truth.
So there have been a number of claims made, and I think there will continue to be a number of claims made. I just ask anybody making a claim, please provide your citations. Please provide, again, respect the science. Let me see the science. I mean, I'm very genuine here. Let me see, the science behind this actually reduced the symptoms, or this prevented deaths, or this prevented transmission. I would like to see the science. Dr. Vaughn, you are really specializing in the blood clots. I've seen video after video, picture after picture of these long white blood clots in autopsy. We've also, throughout COVID, autopsies were really discouraged. We weren't seeking the scientific truth. I see Dr. McCullough, I'll have you kind of answer that, but Dr. Vaughn, first talk about the clotting we saw and what you know in terms of what was discovered under autopsy.
Well, first of all, early in COVID, the spring of 2020, my collaborator, Jacques Lobscher in South Africa, was the first one to kind of alert people to say that this was primarily a vascular disease, not a pulmonary disease. And that's one of the reasons that ventilators are probably one of the most ineffective things you could have done to people, because if you have a vascular disease of the lungs, increasing the intrathoracic pressure just closes down more vessels and ultimately kills them. And what we also saw was if you went into the hospital in the spring or summer of 2020, you were twice as likely to leave alive if you were already on a blood thinner. Now, I will tell you, most of your friends that are on blood thinners probably aren't healthier than you. So it's kind of interesting to find out that the people that were on blood thinners had a protection. So again, those were signals that were really downplayed. Unfortunately, after a lot of the treatment was codified by the CARES Act, it resulted in basically a protocol-based treatment for in-hospital care.
As long as you start, anybody describe remdesivir? Anybody want to speak to that? If not, I'll do that for another hearing. I mean, just the conflict of interest of how that was being approved. So we'll wave off on that.
But what we uniquely found, and my collaborators in South Africa, Risha Pretorius and Doug Kell at University of Liverpool, was that the spike protein was able to induce fibrin from fibrinogen, which is a fancy word for saying, hey, forming the backbone of clotting. But it did it in a way that was different, that we had not seen. And it was what we would similarly think of fibrin as kind of like spaghetti coming out of the colander that you could pull apart when you didn't need it. It was easy to break down. But the actual clot that was formed in COVID or from the spike protein from the vaccine was like burnt spaghetti casserole that you have to get a Brillo pad to get off the dish. And a lot of people, their issue is their inability to break down that clotting mechanism. We all need to clot, but we all need to actually get rid of the clot, and that is the problem.
That's pretty obvious. Was ignored. Dr. Thorp, I'll get to you, but Dr. McCullough, real quick.
Quickly, in the last 5 years, I've never treated as many blood clots in my entire multiple decades of in clinical practice as a cardiologist. The blood clots occur after the infection with the virus and the vaccine because the spike protein causes blood clots. It's without any controversy in medicine, the spike protein causes blood clots. So it is reckless and foolhardy to continue to vaccinate people and load the body with spike protein and cause more blood clots.
There were other parts of the coronavirus that they could have used in the lipid nanoparticle. I mean, they could have injected something else that wasn't quite so toxic.
Yeah, it actually, a paper in Cell, July of 2021, it's called Broad and Durable Immunity from basically COVID. And what they found was the nucleoprotein was actually the thing that supplied broad and durable immunity for actually prevention of infection. Unfortunately, the spike protein did not elicit that response. And as much as we love this mRNA technology, it seems like they sold it as something that we could change on the dime as information actually came to light. And by July 2021, we knew the wrong protein had been picked. Why didn't they change it?
That's a good question. Senator Blumenthal.